Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. We're here to provide our community with the most up-to-date information available on the county's response to COVID-19. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. This meeting is being interpreted by Joe Black in American Sign Language, and a Spanish language interpretation by Carlos Saracedo will be available on the county's website and YouTube page shortly after we conclude this press conference. It's been exactly 2 weeks since Governor Newsom ordered all Californians to stay home to prevent the spread of COVID-19. We're all wondering about the effectiveness of our physical distancing efforts. California's Secretary of Health and Human Services announced Wednesday that California is in a completely different place than the state of New York. Governor Gavin Newsom also said Wednesday, "I hope we continue to be, but we won't unless people continue to practice physical distancing and do their part, and we continue to meet this moment." California's aggressive shelter-in-place order is slowing the spread of the virus and buying the time we need to prepare for a surge of COVID-19 patients in our hospitals. We can't rest or backslide. Relaxing physical distancing and not taking the necessary steps to prevent the spread of the virus will lead to lost lives. While compliance with the health order locally is very good during the week, we've seen an uptick in concentrations of people and gatherings in parks and neighborhoods on the past 2 weekends. As tempting as it is to think it won't matter if we have an extended family get-together because it's just family, don't think that. COVID-19 can and will spread among people who are related or among strangers. The only people who should be together outdoors are those who are currently living in the same household. If you want to take a walk on the beach, hike a trail, or visit a park this weekend, please have a backup plan in mind if there are too many people doing the same thing. Don't think it won't matter because others are doing it. It does matter. Every single additional indirect contact can spread the virus. As a reminder, please stay home. Wash your hands regularly and disinfect surfaces. Try avoid touching your face. Keep at least 6 feet of distance from other people. If you feel sick, isolate yourself. If your symptoms become worse, call your healthcare provider and follow their medical advice about what to do next. From our local hospitals and restaurants to our agricultural businesses and technology companies, our local businesses shape the identity of our county. Many of our local businesses are scared about the economic impacts of COVID-19. They're scared about how they'll be able to keep their doors open, about how they'll be able to pay their employees, and about how they can best provide for our community during this time. There is no single solution to address these concerns, but more and more programs and assistance are coming online to support the economic vitality of our county. Signed into law last week, the Coronavirus Aid, Relief, and Economic Security CARES Act provides more than $350 billion to assist and support small businesses. Our local chambers of commerce teamed up on Wednesday to provide businesses with information on how to apply for the assistance program that are included as part of the CARES Act. The Paycheck Protection Program, one of the most important features of the CARES Act, provide loans for small businesses that keep employees on their payroll. Some of these loans will be completely forgiven. The application period for this program opened today. If you're a business owner, please act quickly to take full advantage of this program because the funds available are limited to a first-come, first-served basis. I know there have been many issues trying to apply, but please be persistent. Since March 19th, Santa Barbara County has been an eligible location for the Small Business Administration's COVID-19 assistance program. The CARES Act also includes and strengthens assistance for workers who've been laid off as a result of COVID-19, increasing the weekly unemployment insurance benefits by $600 per person and extending coverage for an additional 4 months. These benefits are also available for part-time, self-employed, and gig economy workers. For more information on these programs, please visit readysbc.org/economic recovery. You're also welcome to email covidbiz@countyofsb.org. That's covidbiz@countyofsb.org. If you have any questions, please don't hesitate to reach out. As I mentioned last week, please visit 805undocufund.org, 805undocufund.org, to learn about the support that is available for undocumented workers in our community. Next, I'd like to introduce Dr. Vaughn De Reynoso, the county's Director of Public Health.
Thank you. Good afternoon. Today, we are reporting 13 additional cases of COVID-19, bringing the total number of cases in our county to 152. The ages of the new cases range from 20s to over 70 years old. Of these new cases, 3 are in South County unincorporated area, including communities of Montecito, Summerlin, and the city of Carpinteria. 2 are in the city of Santa Barbara, an unincorporated area of Mission Canyon. 1 is in the Santa Ynez Valley. 3 in the city of Lompoc and the communities of Mission Hills and Vandenberg Village is 17, and 4 in the city of Santa Maria. The status of the 152 cases: 86 are recovering at home, 26 are recovering in the hospital. As we reported earlier in the week, 1 death, and 35 are fully recovered. And we are awaiting an update from our disease control team on 4 cases. I would also like to restate the importance of social distancing. I urge everyone to continue physical distancing during important family milestones such as birthdays, funerals, or religious celebrations. It's natural to want family and friends over to celebrate or to offer comfort or encouragement. However, we can only slow down COVID-19 in our community if we continue to maintain physical distance. In particular, with Passover and Easter coming up soon, this is important. But I'm happy to read about the creative ways people are making plans to celebrate using video calling instead of in-person gatherings. So thank you for doing your part in keeping our community healthy.
Thank you, Dr. De Reynoso. Next is Dr. Henning Azorg, the county's Public Health Officer.
Thank you, Supervisor Hart. Good afternoon, everyone. I would like to inform all Santa Barbara County residents that we at the Public Health Department, in cooperation with our local hospitals, our first responders, and medical community, as well as our neighboring health departments and the state, we are all doing everything we can to prepare to be ready for an expected surge of sick people in our area. Our disease control and containment units have increased their workforce dramatically and are tirelessly following up on identified COVID cases and their contacts in order to limit the spread of the virus to others as quickly as possible. The increased testing capability and faster turnaround times help us identify infectious cases more rapidly and makes it possible to minimize further spread of disease. Our announcement from yesterday recommending the general use of face coverings may have left you with some questions that I would like to address. First, I would like to emphasize that this recommendation is meant as an additional precautionary measure and by no means should replace our keeping a physical distance and frequent hand washing routine. The use of these face coverings is particularly recommended when going shopping at a grocery store or going to a pharmacy, for instance. Other situations where it will be a good extra precaution would be situations where we have to wait in line or whenever keeping a safe distance is not easy to maintain. We are still experiencing a national shortage of medical-grade masks, and therefore everybody is asked to please be creative and resort to non-medical grade equipment. Homemade solutions made of cloth, when covering the nose and the mouth, are perfectly functional for this purpose of limiting the spread of respiratory secretions, which is the intent of the covering when worn in public. Again, let me point out, we do have the tools at our disposal to limit the spread and slow down the epidemic in our area by staying home and keeping a distance when outside. Stay well, and thank you.
Thank you, Dr. Answerg. Next, we have Suzanne Grimacy from the county's Department of Behavioral Wellness.
Thank you, Supervisor Hart. There's no question that the COVID-19 virus is turning our lives, our world, upside down. But even so, there is something really comforting in knowing that we are truly all in this together. And together we will get through this, and I believe, out stronger than before. When we first learned of the spread of COVID-19 within our county, there was an initial level of stress, of worry, panic of becoming sick. Now, as we find ourselves in the midst of a worldwide pandemic, with cities and even countries shutting down, the overall situation has become a bit more frightening. I think many are finding themselves worrying now more about what is to come, what will happen next, and how long will this last. For many people, the uncertainty surrounding the virus is the hardest thing to handle. There are countless worries and stress surrounding job loss, loss of pay, ability to pay rent, economic recovery, Passover and Easter celebrations for our youth, worry of how school from home will work for them and through the end of the school year, older adults who are feeling isolated, and of course, worry of our own health and that of our loved ones. We can only imagine the stress and overwhelm among our community members who are on the front line, our healthcare providers, teachers, grocery store workers, emergency operations responders, our local public health department, our media, mental health workers, food delivery, agricultural workers, small business owners creatively keeping their businesses going, parents and caregivers taking care of children at home, and so many more, working tireless hours, feeling both vulnerable and courageous. Thank you all so much. Much research shows that having a positive experience within or after a traumatic event can change our experience with the event and make us even stronger. This is what we call resilience. Resilience is the process of adapting well in the face of adversity or significant stress. Resiliency is the capacity to bounce back. Our positive experiences with facing COVID-19 as a community, seeing our community's creative adaptations, strengthening connections, this will also help us to recover faster. We have seen this pattern time and time again within our county, and I'm confident that we will now as well. The virus is contagious, but so are our emotions. Talking to others who tend to be negative or ramp up fears can heighten our own levels of stress. In turn, talking with those who are good listeners and have positive frames of thinking can decrease our stress and help create a positive experience. We have huge opportunities amidst a terrible situation for good stuff to happen, connections strengthened, and our community strengthened. As we end our week and we begin the weekend, focus on strengthening and renewing connections. Spend time with family. Do it through Zoom. Do it on the phone. Do it with video. Get outside and breathe fresh air and move. If doing so, stay 6 feet apart, but always remember to say hello to the others that you see out there. Stay informed, but take breaks from the news. Stay nourished and sleep. This is an emotionally and a physically taxing time for all of us. But with attention to taking care of ourselves and staying connected, together we will make it through this, and we will do so stronger than before. No matter the type of stress or worry you're feeling, you are not alone. The Community Wellness Team remains available for COVID-19 support. The team is led by the Department of Behavioral Wellness and made up of multiple community organizations and is available virtually and countywide. The Community Wellness Team can help connect you to counseling services, virtual support groups, regular check-in calls, or is available just to talk. Please visit the website at sbccwt.org or call 805-364-2750. Thank you.
Thank you, Suzanne. We're stronger together. Next, we'll take questions here in the room. Mr. Fish?
Hi, you mentioned there are 26 patients currently recovering in the hospital. How many are currently in the ICU?
There are 17 currently in the ICU.
Okay, just a second sort of follow-up question, I guess. Information just came out from a prison in Lompoc that 14 inmates there and a couple staff members have tested positive for the coronavirus. Are those members from that prison included in the county's counts? And could you talk just a little generally about how you're looking to keep inmates and those who work at these prisons safe?
Do you know? I don't believe so. You know, I don't believe so, but I will check.
It's a state prison, not a county jail we are talking about. So the inmates there are under federal care. The people who work there, however, are under our care. I'm not aware of anybody there being hospitalized, but I don't have the exact answer.
And again, the numbers we present at the press conference are a static point in time. There will be a difference between things that evolve over the course of the day, but at a set time every day, we announce the numbers that are official, and that way folks have a good sense of the change from day to day. But within a day, there's going to be variations on the reporting from different agencies. Any other questions here in the room?
Just one more for now, and that's, you talked a little bit about local healthcare workers really ramping up their efforts to prepare for that surge in patients at hospitals. What's currently your best estimate for when we might see that surge really peak here?
So we've done some preliminary modeling, and the best case scenario for this model that we have, and again, it's not engraved in stone, but we're guesstimating that we'll peak around middle of May.
Any other questions here in the room?
Yeah,
Okay,
but
we'll
that
go to the
middle of May.
phones now, and so,
we flatten the curve out.
First, we have Reza with the San Ynez Valley Star.
This is peaking now, but there'd be thousands of people going to the hospital. Now the peak's prolonged, but it's not going to.
I don't think that's, I think that's feedback,
It's
so,
working.
can we mute that?
They are all muted except for Reza.
Okay, Risa?
Oh, sorry, my question was answered. Thank you.
Thank you. And another question on the phone?
Yes, we've got Delaney Smith with the Santa Barbara Independent.
Hi, I realize this is for Dr. Anzorg. I realize yesterday you directly answered the question someone asked about healthcare workers and releasing the information of how many healthcare workers tested positive for COVID. And you said no and cited up privacy as why. However, we were in communication today with Cottage as well as Public Health, and we were told that that information would either be released today because Ventura and SLO have released their numbers, or we'd at least get maybe more of a reason of what do you mean by privacy, I guess, a better explanation of why those numbers aren't being released.
I can take that question. So we are working on that data request, and in the days to come, we will be releasing aggregate numbers of the cases who are healthcare workers. So more to come on that.
Okay, awesome. Thank you.
Delaney, was that your last question?
Yeah.
Next up, we have Josh Molina with Newshawk.
Yes, in light of the fact that there's a suggestion for people to wear masks outdoors at the grocery stores and where people gather, I was wondering maybe Supervisor Hart or whoever on the panel could talk about, is there any specific outreach to the homeless population to try to get them protective cloth masks? Is anybody working with them to spread this message to them?
Yes, we have outreach workers who are working with the Department of Behavioral Wellness and other community organizations that are reaching out to folks who are unhoused in our community to get them the information about the COVID virus and the best practices that everyone can take. We have put out hand washing machines and facilities throughout the county, and want to encourage everyone, whether they're housed or not, to constantly wash their hands and practice safe social distancing. And we will be including that information about masks in the outreach effort to the unhoused.
That is all the questions we have on the phone lines.
All right, then we are concluded today. Our next press conference will be Monday at 4:30 in the afternoon. If maybe we have one person left on the line? Nope,
everybody's
okay.
muted.
If you would like to have additional information about the websites that we have mentioned today, the call-in information that gives you access to the various county services and our partner agencies, just please stay tuned on the television screen. The scroll of the websites and the telephone numbers will come up shortly after we conclude the press conference. Thank you for your participation and your attendance today. Thank you.